Alright, on my way home now. Thanks for joining to listen to me flap my gums again. So I don't know how much of a video I'll be able to do tonight because now I have work stuff to do all day. So take that for what it is. But we'll still try to get some videos in here later today. So yeah, I watched Tucker's opening last night, and I think that it's worth talking about. Now look, Tucker's someone that I actually respect as one of the only legitimate mainstream media people. I think he does a fair job. I'm not saying that he's always right. I disagree with him on some things, but I think that he does a pretty good job of trying to bring people on that have differing viewpoints. He seems like someone who's willing to criticize people on his own side. Like, for example, it's obvious he has no love lost for the Democratic Party, but he's praised things like Elizabeth Warren when she's criticizing places like the tech companies and things like that. So, you know, he seems at least like his heart's in the right place. That doesn't mean I agree with him with everything. But I think that he's had some of the best coverage on this. So way back when he was, before the lockdowns or anything like that, Tucker was, he was talking about this virus before any mainstream media person I saw. In January, he was talking about it. And I saw a lot of Trump supporters were like, I'll never watch Tucker again because he's saying this virus is a serious thing. Look, the virus is a serious thing. Even if it turns out to be no worse than a bad flu season, that's still serious. You're talking tens of thousands of people dead. It's serious enough to warrant a conversation. But Tucker was never saying we should have a lockdown, we should do this. He was just saying, look, this is something that we might need to prepare for that's coming down the horizon. And, you know, he was right. So I applaud him for that. But then simultaneously, he's been one of the first people that criticized the lockdown, or at least demanded answers to questions like I was doing. And so I think that he's been good on both ends of it. I really do. So anyways, his show last night, his opening, it's only about 7 minutes. You can check it out. Zero Hedge has a link to it right now. That's where I saw it. So you can check it out if you want. But he's talking about basically saying things that I'm saying, that they're making it up as they go, these experts. They have no clue. Just like I did in my video earlier today. The Pennsylvania experts, no clue. Last week they said we can't reopen some counties because asymptomatic people, the virus has spread to all these counties. This week they say, sure, on May 8th we could open it. They don't give any explanation what changed between last week and May 8th. None whatsoever. They're making it up. They have no clue. And that's what Tucker's saying. No one knows. And he says this is the most expensive experiment ever produced. That we're destroying people's livelihoods, we're taking away people's rights, and they don't know. It's just an experiment. It's their guess. And he talks about it. So one of the things he does is he points out the 8 states that have not issued statewide stay-at-home orders. And each of those 8 states currently have less per capita infection rates, deaths, etc. across the board for COVID-19. Now, how can that be? Now, listen, and then he goes on to talk about places like Sweden. Sweden, which did not do the lockdown, has less per capita infections, deaths, etc. than places like the UK, Italy, Spain, Belgium, all places that had big lockdowns. Excuse me, frog in my throat. Now, I talked about this the other day, and here's what people say. Because it's not apples to apples comparisons, like you can't compare, for example, Iowa to New York, and you can't compare Sweden to the UK. So they'll look at these examples of places that didn't shut down and say, oh, well, the reason that the virus isn't as spread there is because their situation's different. Well, two things that does. One, that proves that even within states, there was no reason to have a one-size-fits-all approach. Because if we could see that there are places that haven't done the lockdown that aren't that bad, then other places that are analogous or closer related to those states or those countries, for example, maybe that don't have as many urban centers and things like that, they should have been locked down in the first place. The lockdown was costly with no benefit in places like where I live in Clarion County, because rural Clarion County is more like the state of Iowa than it is like Philadelphia. So if Iowa didn't have a lockdown and the spread has been less than the national average there, why then would we have a lockdown here in Clarion County? It makes no sense. That's point number one. Point two is this argument, and I made this point the other day, which I haven't seen anyone else make, But the argument, and I'm playing devil's advocate, which is to say, let's look at Sweden, for example, and say, oh, well, with Sweden, you can't compare it to the UK because their healthcare system's different and their population's different, etc. So you can't compare one to the other. So that would explain, even though there wasn't a lockdown in Sweden, why we haven't seen the massive amounts of infections and deaths that we saw in the UK. But there's a problem with this. And the problem has to do with an order of magnitude. And this is a complicated argument, so hear me out. The Imperial College study that the UK and much of the US based their policies off of, this was the one that came out initially that said 2.2 million Americans would die if we didn't do the lockdowns, and 500,000 people in the UK would die if we didn't do the lockdowns. So the lockdown in the UK happens 2 days after that. 2 days after that lockdown, the Imperial College adjusts their number from 500,000 dying to 20,000 dying. Now, that's what, 20 times less? 20 times less people dying. After 2 days of this policy, the lockdown. Oh, lockdown, now almost, we went from huge amounts of the country dying to, oh, almost no one will die now. 20,000. Basically nothing. That, I claimed at the time, was absurd. To say that this, it just reeked of propaganda. Oh, if you give the government your rights, if you don't, it'll be apocalyptic how many people will die. But if you give away your rights, then almost no one will die. It just did not seem scientific to me. It seemed absurd. But let's assume that those numbers are accurate, or at least that they were well-intended numbers. They weren't designed for propaganda. We're talking about 20 times different, 20 times more people dying if we don't do the lockdowns. Now, this would overcome any potential difference in population or in healthcare, right? They're not saying 200,000 people will die. If we do our plan, only 100,000 will die. That's not what they're saying. They're saying 20 times less. That's what these experts said then was, that's how important social distancing is. That's how effective it is. If you don't do social distancing, you could look for up to 20 times more people to die than otherwise would have. So then when we look at a country that didn't do social distancing like that, these lockdowns, such as Sweden, we would expect the number to be of a great magnitude higher per capita of infected and dead than we see in the UK. Now, it might not be exactly 20 times because, yes, the populations are different and you have to give some sort of wiggle room. But when we're talking that social distancing and these lockdowns are so effective that 20 times the amount of people that would have died now won't, then that surely would apply to country. Do you understand what I'm saying? The magnitude of the lives saved from these supposed lockdowns in the Imperial College study would also apply to Sweden. And the fact that we see that's not the case, just like in the States, we see the states that didn't lock down, all of them. If we're right, if we didn't have the lockdown, remember, that's what we were told, millions would die if we didn't have the lockdown. Okay, then why aren't we seeing of such a great magnitude these states that didn't lock down have way more than average the amount of infected and dead? Why aren't we seeing it? Oh, but there's less urban areas there. Sure, that's fair. That would have described some of that. But we're not talking their prediction was a couple thousand more people will die without the lockdown. It was millions will die without it. Now we're going to clock in around 60,000 or something like that. That's what they're predicting. So we went from millions to 60,000 because the lockdown's that effective. So the states that didn't have the lockdown, you would expect there would be catastrophes there. Yet we're not seeing it. I'm going to lose you here in a second. But that's what Tucker's talking about. And he also talks about an expert that went through the numbers, a doctor went through the numbers, and through his numbers showed the lockdown had zero effect. And he looks at the LA County study that shows that hundreds of thousands of people there probably have already had the virus, despite one of the most draconian lockdowns. How can you explain this? And they'll just say, oh, but the Stanford test, right? And I've talked about this ad nauseum like yesterday. Oh, those tests, remember, my initial complaint was, look, we should question this. We should question the experts. We should make them answer questions before allowing them to take away our rights and destroy the economy. No. We don't have time for that. You have to accept the experts. And if you don't agree with that, you want people to die. That's what I was told. Now when experts are coming out saying, wow, actually the mortality rate's way lower than we thought. What are these same people saying? numbers, no, we don't like those. The Stanford numbers, no, we don't like those. The Sweden numbers, no, we don't like those. Numbers in Germany and Italy that have showed us the mortality rates later, no, we don't like those either. So it's just trust the experts as long as they agree with me and they agree with the government shutdown. But don't trust any experts that disagree with us. They're going to claim that this lockdown was successful. But let me make this plea to you, right? This has cost trillions of dollars. It's cost people their livelihoods. It's taken people's most important thing. But let's forgo that for a second and just say the money. If your mechanic charges you go for a simple oil change and you show up and they're like, yeah, we charge you $5,000. And you're like, why? And they just say, well, trust us, your car won't blow up in the next year. So therefore, you know the money was well spent. You would demand to know everything about that money. Why? What did you do that warranted $5,000? What exactly was the problem? How exactly did what you do for $5,000 fix it? You would demand answers. Do the same here. Don't let them say, oh, only 60,000 people ended up dying, so therefore it was a success. Make them prove the lockdown was successful. Don't allow them to say, well, we'll never know. That's garbage. You're the ones who cost trillions of dollars. You're the ones that took people's rights away. So it's on you, government of all sizes, Republicans and Democrats, in Congress, in state governments. It's up to you. The cost was so heavy, it's up to you to be able to articulate why that cost was justified. Exactly how those policies with that high cost saved lives. Because right now the data's showing the opposite. And the only defense is, well, okay, those states or those countries that didn't lock down, we don't know. We don't know what it would have been like if we did that in other states. That's not good enough. That's not an answer. When did the default position become, if we don't know, we strip people of their rights and we tank the economy? When did that become? Of course the Dems are worse by far. But that doesn't mean that the Republicans didn't go along with it. Name me one Republican. Rand Paul, maybe? Other than that, Massey was another. But other than them, name me one Republican that initially, when these lockdowns were occurring, were like, yeah, this is unacceptable. Name me one. So yes, the Democrats are worse. Doesn't matter. Make them prove why the lockdown saved lives. We know the lockdowns cost. We know the $6 trillion already that we're on the hook for. The blank check that we've basically given the government so that places like, museums and other places could get $1 million. That's just millions. We're $6 trillion. Who cares if a couple dozen million go to this place and a couple go to that? Who cares? I care. But make them prove it. Don't let them get away. We see the states that didn't lock down. They're doing just fine. If the fear-mongering was correct, then they should say, look, again, remember, the video I just did before this. Governor Wolf says, starting May 8th, a lot of these counties that have had few cases are going to start reopening up. But wait a minute, if we listen to Dr. Fauci and if we listen to all the people that have been telling me, oh, you can't reopen back up, you can't open up these places or it'll spread, all of a sudden they'll change their tune. Oh, no, it was okay to open those up. So, all right, I got to head off and do some work. So thank you all for listening. I really appreciate it. Stay safe out there. And if you have a business, open up. Exercise your constitutional rights. I'm tired of it. So, all right, thanks so much, everyone. Have a good one.